Hi, I'm Dr. Roy Mukku, and I'm an interventional cardiologist at Providence St. Joseph's Medical Center in Burbank. I grew up in the Bay Area and attended UC Berkeley for my undergraduate studies, and then went to medical school in Houston at the University of Texas. After that, I jumped to New York City, where I did my residency in internal medicine at NYU. I worked for a year as a hospitalist at Memorial Sloan Kettering Cancer Center, and after my fourth winter on the East Coast, I decided it was time for me to come back home to California. I continued as a hospitalist at UCLA Medical Center, which I feel really strengthened my decision-making skills and experience as a new physician. Being a hospitalist for a few years also helped me develop a patient and care team-centered focus. I always had a love affair with cardiology, so eventually I decided to pursue a career in it and moved up to San Francisco, where I completed my cardiology fellowship at California Pacific Medical Center. And speaking of love and cardiology and hearts in San Francisco, that's also how and where I met my wife, who's now a hospitalist at Providence St. John's in Santa Monica. So after completing my cardiology fellowship in San Francisco, we moved back down to Los Angeles for me to complete a subspecialty training in interventional cardiology at UCLA. Interventional cardiology is a subspecialty of cardiology. It's a minimally invasive, catheter-based microsurgical discipline that focuses on the heart and vascular system. Interventional cardiologists are the physicians who typically place stents in coronary arteries, replace and repair valves using minimally invasive techniques, and perform a variety of other arterial and venous procedures. Ultimately, the goal of interventional cardiology is to improve the mechanical function of the heart. Cardiology is basically plumbing and electricity, and interventional cardiologists were the plumbers and get blood moving again. My position at St. Joseph's Cardiology Institute in Burbank was truly providential and a real stroke of luck. There was a senior cardiologist partner that was retiring from clinical practice, and they needed someone to provide ongoing care for his patients. I knew it was the perfect fit from the beginning because I immediately clicked with the other partners in the group. As the newest member of the group, it felt like a great opportunity to grow personally and professionally. My philosophy of care uses evidence-based medicine to help me guide the most effective individualized treatment for patients. I work closely with patients to develop a shared approach to care while often collaborating with my cardiology team to formulate options for a treatment plan. And then I present these options to the patient and ask them, what do you think? It's so important to get buy-in from the patient regarding their treatment plan, whether it's a medication, a procedure, or significant lifestyle changes. This way, patients are more engaged because they have a more active role in their care. I like working with patients and connecting with them to affect those changes. Having lived and trained in different parts of the country has given me a perspective into social and cultural differences that help me be a better doctor. So why Providence? Providence St. Joseph is a unique combination of a community hospital with the care on the level of a university hospital system. Patients receive the highest quality care in outstanding facilities, yet in an intimate setting. Patients really appreciate the personalized approach to care and don't feel as though they are getting lost in the system. They are cared for by a dedicated multidisciplinary team of specialists and ancillary services within St. Joseph's. Providence Medical Institute is the major cardiology group from Glendale to the Valley, and we care for the large population base of patients in this geographic area. We're a growing center of excellence and offer vital cardiovascular care and services to the patients in our footprint. I'm so glad I'm with Providence St. Joseph's Cardiology team. Thank you.